Today's guest is a true trailblazer in the world of health, healing, and medical innovation. Shayna is a registered nurse and nationally board certified nurse practitioner with over 30 years of clinical experience specializing in both adults and pediatric care. She is a multiple award-winning healthcare leader, recognized as Healthcare Pro of the Year, and recipient of the prestigious VIP International Lifetime Achievement Award and a 2026 Nurse Practitioner of the Year nominee. What truly sets Shayna apart is not just her credentials, it's her journey. After suffering from multiple autoimmune disorders, including MS and heart failure, Shayna refused to accept a life of decline. She turned inward, integrating holistic, naturotherapy, functional medicine, and advanced clinical insight to identify and correct the true root cause of her illness, healing herself at the cellular and genetic levels to become free from symptoms, flare-ups, and medication. Please welcome Shayna Melissa Stockman, the autoimmune expert.
Thank you for such a wonderful introduction, and thank you for inviting me aboard.
I mean, you've spent years really battling debilitating symptoms and being told by conventional medicine that your lab results were normal.
Yes.
What was the breaking point or the moment when you realized you had to stop looking for answers in a doctor's office and start looking for them really at a cellular level?
That's a great question. I feel a lot of times, I don't want to bash all doctors, but a lot of times they tend to blow off the patient's symptoms and they really don't listen to the patient's screaming symptoms. And, to be told your tests are normal, I'm like, I don't feel the way I should feel. I did not feel this way last year. So symptoms were adding up. There was no traditional medicine did not give me any answers for my symptoms. And the breaking point for me was when I went to a cardiologist who was a heart failure subspecialist. And he said to me, I said, Doc, we have to get to the root cause because that's the only way we can stop the progression of my heart failure to try to reverse it. And he said to me, listen, 95 to 98% of my patients, I never find the cause of their heart failure. And I'm like, wait a second, I am getting worse and worse and worse. And you're just throwing meds that don't help the symptoms, don't make me feel better, give me more side effects. So I said to this cardiac subspecialist in heart failure, Doc, with all due respect, and I knew the answers, are any of these meds are going to stop the progression of my disorder, my heart failure? No. I said, well, are they going to at least slow it down? No. And I said, well, Doc, they sure as heck don't help me with the symptoms. So that was a breaking point for me. And if I wasn't a nationally board certified nurse practitioner myself, I honestly would be dead because I had to order my own tests to prove that I had problems because they were ordering bare basic tests. They blow off symptoms. They weren't listening to the patients and they were ordering the bare basic minimum. And I actually worked for a cardiologist for 4 years at the time. And every patient that came to him that was a lady got a prescription for Xanax if she had palpitations or chest pain. And every man got the stress test. So, of course, I was given the prescription for the Xanax. And I actually ordered my own echo that showed I was in heart failure. I'm like, I worked for you for 4 years, never had a sick day. If I'm telling you there's something wrong, there's something wrong. I never complain. So I ordered my own testing that proved I was in heart failure, my own chest x-ray to show my lungs were clear, my full blood work to show no other cause of fatigue.
Wow, what a story. I mean, most people don't have access to things like that as you did, and you were listening to the doctor, trying to do the best of your knowledge. You went from patient to practitioner, really. How does a functional medicine approach differ from the traditional pill for every ill model that we see in standard healthcare?
Okay, I do have 5 college degrees. 3 of them are from SUNY at Stony Brook. My grandma raised me with functional medicine before there ever was a school of functional medicine. So that's where I originally learned functional medicine was in the 1970s, growing up with my grandma, where I would watch that my grandpa was a licensed pharmacist, died of a lethal drug interaction, prescription drug interaction. And that's probably why my grandma looked at powers of the plants and food as medicine. So I would watch my grandma eat a banana every day, and in later years discover bananas have potassium, magnesium. That helps your blood pressure and your heart rate. So grandma was using food as medicine in the 70s, and that's where I first learned about naturopathy, attacking root causes, and even biohacking before there was a term for biohacking. I would watch my grandma, all of her siblings, brothers and sisters had diabetes. She decided to watch what she consumed, lower her processed sugar intake, keep her weight down, and never develop diabetes. So I learned from her in the 70s that we can biohack so that our genes are not necessarily expressed, even though we inherited the gene.
I mean, speaking of terms, the phrase root cause, I mean, that is used a lot in wellness today, but many people don't know what it actually looks like. In your work, how do you differentiate between treating a surface level symptom like fatigue or even brain fog, and instead identifying the actual functioning imbalance that could be driving it?
Because I feel modern medicine will just address the symptom, never attack the underlying root cause. So if you go to the doctor with fatigue, they might give you a stimulant drug like an Adderall or a Ritalin to address the fatigue and not attack the root cause. I describe it like this. If you have a roof that leaks and you put a bucket underneath it, that is a quick fix, good for now. And that's what medicine typically does. It treats the good for now symptom, but it's never getting to the root cause. So now that roof leak is getting bigger, 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 bigger. If you look at people, they're on typically 3 blood pressure pills, 3 pills for diabetes. Why? Because the medicine was not stopping the progression. And then they needed a higher dose, a 2nd blood pressure pill, a 3rd diabetes pill. So I always look to attack the root cause, because only when I attack the root cause can I stop the progression of the disorder and even reverse it. Now, when I reverse it, the symptoms typically go away. And when the symptoms are gone, there's no need for the medicine to treat the symptoms that aren't there. And then without the meds, there's no side effects, interactions, overdoses, and deaths. Whoa, what a concept.
I mean, we become masters of symptom control, really. I mean, in your search for the root cause, there is no one size fits all. So when you're looking at a client's unique biochemistry, what are some of the markers that you look at that a standard, maybe annual physical, might miss?
There are so many of them. First of all, I look at everybody as an individual. So it's based on their symptoms, their family history, what tests they had that were normal, what tests that they had that were abnormal. And it's almost like a puzzle where I have to put all the pieces together. Where a traditional doctor, you say you're fatigued. Okay, I checked you for anemia. You don't have that. Well, what do you have? So I will keep digging, digging, digging. Some of the common tests that I run that doctors typically don't are for autoimmune disorders. A lot of the clients that come to me with medical mysteries, it's underlying autoimmune disorders. And there are several different tests to be done, but I have seen so many patients that have, say, weird signs and symptoms blown off of the doctors by years and all the specialists, and they had Hashimoto's. And I'm like, because the typical doctor, I don't want to bash them all, but a lot of them just do the bare basic thyroid test. I do the entire thyroid panel, T3, 4, 7s, thyroid antibodies, autoimmune antibodies. I also check their inflammatory markers to see if they're elevated, because that's a good clue on the treatment you're doing, if it's working or not. So inflammatory markers like sedimentation rate, called ESR, homocysteine level, and high sensitive C-reactive protein are just a few of them.
Wow, just a few of them. Like you said, there are many. Many people initially may come to you wanting to lose weight, but you focus on metabolic health. Can you explain why dieting often fails when the metabolism is broken? And how do you help them rebuild their engine rather than just cutting calories?
A lot of times people will try to starve themselves to drop weight, but the problem is what that's doing to your body is that's telling your body you're not getting the fuel, so slow down the burning of the calories to conserve the fuel. So sometimes small frequent meals are often better. And I had a client not too long ago, he was well over 300 pounds, new patient to me, came in for knee pain. And I said, you know what, your blood pressure's a little high, runs in the family. Oh, your fasting sugar's high, runs in the family. Well, your weight's a little high, it runs in the family. But I empowered him with the knowledge to know that it was not just genetics. Just because it ran the family, he learned how to eat large portions of foods that were processed by his parents. And then he also learned the sedentary lifestyle. So once I empowered him to realize that he could take back the power and do things to help with the weight, like eat healthier choices, smaller portions, and to increase activity, that he dropped over 100 pounds. And this is before the GLP-1s. Then his pain in his knees got better, his diabetes went away, his high blood pressure went away. Whoa, what a miracle.
So what we eat matters, the amount we eat matters. You've spoken about the gut being the second brain. For someone with anxiety or mood swings, how often do you find that the solution actually lies in their digestive tract rather than just in their head?
That's another really good question. A lot of times, when especially ladies go to the doctor for palpitations, they're told it's anxiety and they're given a tranquilizer or told they're depressed. But a lot of times, it's their metabolism underneath. They might have autoimmune Hashimoto's creating the palpitations and or thyroid storm. So I have to always attack and address the underlying root cause. And often sometimes it's long-term depression coming out as anxiety, but more often than not, it's an autoimmune issue where their hormones are dysregulated and it's causing the heart to race.
Even with perfect diet, you've argued that high cortisol can undo all the good work many times. How do you integrate the nervous system regulation, and does stress matter?
People need to realize that stress creates physical ailments. If you look at, say you're nervous when you were in school before a test, right? Your heart starts racing, you might even vomit. So we have to realize that the mind controls the body. And by the same token, signals go both ways. You have to have a healthy gut to send signals back to the brain and the nervous system. And it's not just a one-way street, it's a two-way street, but also it's a triad. Because if you know your anxiety gives you palpitations, then that's a two-way street. You have to have a healthy heart to send signals back to the nervous system. So I believe the gut sends signals to the brain and to the heart and vice versa. So it's a triad and both of them work both ways. They're two-way streets, not one-way streets. So you have to heal the leaky gut theory in essence. You know, too many times we're on so many antibiotics over the years, that's destroying the natural flora in our gut, and that's sending missed signals back to the nervous system and to the cardiovascular system.
It's a two-way street, and yet I think most of us are more aware of that one-way street because that's the one that gets our attention. Your website is World Wellness Expert, but honestly, you're known as an autoimmune expert. Can you tell me why this is such an important aspect of what you do?
I am very, very, very passionate about it. Part of the reason is because I had suffered myself from multiple autoimmune. And if I wasn't a nationally board certified nurse practitioner who could order my own test to get the diagnoses I need after all the doctors failed me, I literally would be dead right now. So I want to empower others. The typical person, now you need to understand, autoimmune is a leading cause of death in young to middle-aged women. However, most of them are blown off for years because their symptoms are vague and there's not a specific one test to treat them. So when they are misdiagnosed for years before they come to me, that means they weren't treated correctly and they've been suffering for years. And unfortunately, a lot of them die before they get correct diagnosis and treatment. And the prescription drugs used to treat them is also another leading cause of death. So it is imperative. Now, when you go to the doctors, if you have cancer, you go to the cancer doctor. You have a broken bone, you go to the orthopedist. There is no autoimmune expert in your plan. There's not a doctor that you go to. So I want to be that autoimmune expert for them because they don't have one.
Wow. I mean, so we've talked about the digestive tract. We've talked about how what you eat matters. What about just simply hereditary genes? Is that something that plays a part here?
Yes. So people need to realize you have the power. Just because you have a gene for a disorder, say diabetes, does not mean that gene is going to be expressed. You can biohack to take back the power of your genetic expression to even suppress it. My grandma taught me in the 70s, all of her siblings had diabetes, but she watched what she ate, watched her processed sugar, stayed skinny, and never expressed the gene for diabetes. Just because you have the gene doesn't mean it's going to be expressed. So it's important to do whatever you can proactively. If you have lung cancer in your family and you don't smoke, that will better your odds of not developing that lung cancer. So you need to realize just because you have the gene doesn't mean there's nothing you can do and that you're doomed.
You have had some great results. Everyone is looking for results. How are you able to measure these results? How do people know that they're on the right path?
I love this question. Before now, it was often alternative medicine was blown off because they didn't have proven measurable results. I actually have 11 different categories in which I measure my clients before and after. I have HbA1c showing diabetes and glucose before and not after. High cholesterol before, not after. Inflammatory markers. I had one client recently, a fellow nurse, she said for the first time in her life, after working with me, her inflammatory markers were normal. So this one nurse that came to me with lupus, she had diabetes, high cholesterol, protein in the urine showing the kidneys weren't working good, was throwing clots. They wanted her on meds for all of that, low energy. And I was able to measure all of those beforehand and after. And after working with me, her diabetic level, her A1C, 3-month sugar average was normal now. Her sugar, her glucose was normal. Her cholesterol was normal. Her bleeding times were normal, showing she's not clotting anymore. And for her proteinuria went away, showing her kidneys were functioning normal. And for the first time in her life, her inflammatory markers were normal. So I have 11 different regions and multiple tests within each region that I measure them. For like myself, I measured my ejection fraction, how much blood my heart pumps out before my techniques and then after. And I was in heart failure and I'm not anymore. So we need to know that now there are proven measurable outcomes in multiple regions. It's not just the patient saying, I feel better.
Exciting to see alternative health options that we can actually measure. That's exciting for anyone. I mean, you were a coach, a keynote speaker, but you're also an author. Your
Yes.
book introduces OLO. While many health books focus strictly on what to eat, OLO seems to kind of bridge the gap between physical health and overall life fulfillment. What was missing in traditional wellness coaching that led you to develop this comprehensive life outcome approach, would you say?
Excellent. Well, the book Overcoming Life Obstacles, that's why I created OLO, for overcoming life obstacles and optimistically lifting others. So after you overcome your life obstacle, then you're celebrating at the top of the mountain, yelling instead of yes, OLO. And then you're reaching down and optimistically lifting others. So it's a double OLO. A lot of the pieces that we're missing in traditional medicine is what I put into my 90-day program. It starts off with the mindset. Mindset lays a strong foundation. If you think you can't, you can't. If you think you can, you can. So I start off with mastering the mindset by retraining the brain. You are worthy. You are deserving to treat yourself as good as you treat others. Why not you? Why not now? So I developed mindset. I go into all of the root causes. I go into what their body is depleted in, leaky gut, cellular inflammation, toxin accumulation, mitochondria malfunction and destruction, biohacking techniques, everything, naturopathy, plant-based, a holistic approach, body, mind, and spirit, plant-based when possible, integrate in meds if we need them. It doesn't have to be meds are alternative. It could be the best of both worlds, depending on the person.
In your writing, you discuss how people often get stuck in an infinite loop, maybe of trial and error with their health. Can you kind of share an example of how the OLO method has maybe helped a reader break that cycle and finally move from managing their symptoms to achieving a long-term health outcome?
I look at it like this. Smart people learn from their own mistakes, but wise people learn from the smart people's mistakes. So I want the readers to be wise and learn from my mistakes. You know what? The typical person could spend years doing Google research. You could spend your entire life researching. And the typical doctor says, here, try this. Here, try that. You guys are not guinea pigs. You don't have to try this, try that. As the autoimmune expert and 30 years as a licensed healthcare pro and 5 college degrees, I know what works and what does not work. I don't have to tell my patients or my clients, try this, try that. I'm like, hey, this doesn't work. This does work. So I use what's helped me as the autoimmune warrior and help thousands of my patients literally from around the world so that they can learn from our mistakes. Because I know what didn't work for me and I know what worked for me and I know what didn't work for my clients and what works for my clients. So I could, the premise of the book is that the readers could learn from my mistakes to expedite their own journey. Maybe it could inspire them and say, if she did it, I can do it. And then also give them the tools that they can overcome, but do so at an expedited pace.
Wise people learn from smart people's mistakes. I like that. That is very smart. Let me ask you this. Recently, you were awarded. Really being able to share not only with clients, with patients, but even with other professionals. Is that important to you?
Yes, yes, yes. When I empower a patient with my unique techniques, that helps one person. When I empower a healthcare professional, and each healthcare professional can impact 1,000 lives per year. So that is my mission, passion, and purpose, is to also enlighten the healthcare professionals. Because when you go to the doctor, if you're not aware of all available options, you cannot make an informed decision. The only way you can truly make an informed decision is if you are aware of all options. So now I am educating doctors and residents and nurse practitioners and nurses with my truly trailblazing unique techniques that they can, it could have more of a compounding effect. So instead of me just teaching a patient, each healthcare pro could impact 1,000 lives and per year. So if I educate 1,000 healthcare pros per year with my techniques and they impact 1,000 lives between patients, family, and friends, that's 1 million lives. And I can replicate that each and every year.
That is exciting. I mean, truly unique approach that you're teaching others. I can see why you were awarded for that. Before we let you go, as you look towards the future of World Wellness Expert, what is the one fundamental truth about health that you want every person watching today to understand so that they can reclaim their own vitality?
You have to believe to achieve. When my elderly grandma stopped walking, the doctors gave up hope on her. And I gave her the belief it was possible. I knew I had to attack the root cause. So because I gave grandma the belief she could walk again, she did. So you have to believe to achieve, take consistent action, never ever quit, and reach out to people who have been there, done that, because they're the only ones that can show you the way. It's like if you ever ask for directions from someone, right? And they're like, oh, I've never been there, but maybe it's a left and a right. Stop taking directions from people who have never been where you want to go because they can't tell you how to get there. They've never been there. So take directions from someone who's been where you want to go. If you want to overcome your autoimmune disorder, that is my area of expertise, my mission, my passion, my purpose. Who better to show you how to overcome an autoimmune disorder than someone who has been there, done that, and overcome autoimmune disorders, but also has the 5 college degrees, the 30 plus years as a licensed healthcare pro.
That
So
is
reach
great
out to me,
advice.
take my 90-day program, start off with an hour deep dive consultation. You know, they typically wait 3 hours at the doctor to get 3 minutes of time. My consultations are a massive deep dive, an hour long. Like that's, I don't know
They
anyone
could,
else that does that.
they could probably learn more in the 3 hours in the doctor's office if they actually did some studying and research on their own and then they learn in 3 minutes.
But it's also important to know a lot of us are looking for a Google for our health. But the problem is this, if you won't rely on Google to fix your car or your electric or your plumbing in your house, why are you relying on Google to fix your one life where you can't get replacement parts? No, and
Yep.
there's too much misinformation and there's too many doctors out there that are acting like they know and giving misinformation, and people are relying on that misinformation.
Absolutely. Listen to people that have been there and done that. That is great advice. Viewers, let's take a look at the bottom of the screen right there. What you're going to see is her website where you can simply sign up, first of all, for her newsletter and feel better, live lighter, and get general wellness tips and insight. You can learn more about all the holistic health plans that she offers and about this functional medicine visionary, really, who is proving that you are not your diagnosis, but you're really a blueprint for healing waiting to be unlocked. Once again, remember that you're not alone. That is the World Wellness Expert. Feel like you again. This is Gary Atensa with CNTV, and if you don't know, now you know.